Hello, everybody. Welcome to another year of this great conference. I want to thank Living Beyond Breast Cancer for inviting me to moderate this important discussion today. And I'd like to also thank Kathy and Joy for being willing to share their perspective and their experiences. And I hope that this is a meaningful discussion for you. So I'm just going to jump right in. The topic is about living with uncertainty with metastatic breast cancer. And I just want to know from both Kathy and Joy, and Kathy, maybe you could get us started about what that means to you. Tell me about the uncertainty that you manage with metastatic breast cancer diagnosis.
Well, when I got my diagnosis, I was one of those people who was a list maker and a scheduler and a planner. And immediately that all went right out the window. And I'm finding that even 3 years out in treatment, since treatment will never end, I've found that I still have to remind myself not to live just scan to scan, because there is a certain amount of in me that I still want to plan things. I still want to be able to look ahead, and I have to allow myself to do that, but it's hard. It's really difficult to allow myself to do that after everything being so scan dependent, and it's just a whole different ball game now.
Yeah. Joy?
Yeah, I would say my uncertainty for me is a little different than when I was in the early stage, because I focused on, hey, is it going to come back? Is a recurrence going to happen? And with MBC, but now with MBC, it's just a little bit different for me, because it's, number one, I'm not waiting for it to come back. It's here. It's going to be here forever. And then I'll be in treatment forever. But more so, my anxiety and my uncertainty is really around, is my treatment going to stop working, or am I going to have to change treatment lines? And if I change treatment lines, does that impact my future availability for clinical trials? And what are all these different dynamics with me changing treatments? And that's some of my anxiety. And then, hey, if the treatment stops working and I have to go over a new treatment, is it going to be covered by my insurance? Or how do I get that covered if it's not? And I really just have to think about MBC in every aspect of my life as well now. Before, I kind of, when I have early stage, I just kind of kept moving. But now I have to more think about, hey, is it in my every decision I make? How do I craft my day? Like Kathy's saying, how do I kind of schedule, here my list, or the things I need to get done, but then how do I make sure I craft my day around how I feel, who I want to spend time with, or where my career is going, or what legacy I want to leave. So it's just, now I just have to think about it in every aspect of my, every aspect of my life. And it's just, but to be fair, Dr. Ginsburg, like uncertainty comes with, just living, whether it's with MBC or not. And especially the times we're living in right now. So.
Yeah. Well, and that's a really important point, Joy. I mean, I think that we have to realize that we always live with a certain level of uncertainty. But I will say that, as a psychologist, I know that human beings do not like uncertainty very much. We don't like it, and we find it to be very uncomfortable. And the level of uncertainty with this specific diagnosis certainly is very high. And it's something that, for anybody who has this diagnosis, it's like you have to make room for it in your life, as you were saying, Joy. You have to put it in its place in your life. So tell me about the coping strategies that you have used over the course of this diagnosis, even in your early stage, but now especially in your metastatic diagnosis. Tell me what strategies, because people always want to know about strategies. What specific strategies have you come to use that have been helpful for you?
I would have to say, I'm not quite sure if I describe them as strategies, but the first one is definitely kind of prayer and perspective. I just have to make sure that I'm grounded and making sure that I understand, so I can continue to be hopeful and grateful and understand that I am blessed to be here every day, and blessed to spend time with my friends, my family, and things of that nature. But I would also say that information is my strategy. And what I mean by that is I need to know everything about, I want to know everything I can about my disease, the treatment options, new treatment options, clinical trials, that are evolving, so that I can have conversations with my doctors about, this is how my current treatment is going. This is what my next, and if it stops working, this is the next treatment, or this is what we're going to do next, just to be able to kind of plan from a treatment perspective and kind of reduce my anxiety of what's going on. And hey, it's and understand what my side effects are, understand what I can do about my side effects. And the other thing I would have to say is not just from a health perspective and planning, but also from a financial and kind of insurance perspective. Like, if I lose my job tomorrow, or I get laid off, or my health status changes where I need to, stop working, and what do I do? What's my contingency plan? Do I know what about disability, or what other type of financial, how do I get insurance, or those financial types of this thoughts? I have to make sure I know all the information about what those things are too, to kind of help me have a plan, and then my plans have plans.
Yes. So in other words, if I could sum that up, in other words, you really like to have your plans. So, yeah. Well, and what that does, I mean, if you think about that, your education and your preparation does help to reduce a certain amount of uncertainty. There's always going to be some uncertainty there, but it helps to reduce a certain amount of it if you have some sort of at least general plan in your mind and you're educated. And Kathy, I noticed you nodding when Joy said education. So tell me a little bit about that with you.
Yes, I stay. When I was working, my life was in science, and so being immersed in that literature thing is part of it. I agree with Joy. You kind of try to soak it all in, and I think you can get on overload. Sometimes it can be kind of exhausting, but it absolutely is part of what I do. And I'm with Joy also as far as faith. That's a big piece. It has to give me perspective each day, and I like to go out for a walk. I journal every day. Those are things that have helped me stay grounded in the moment. When I find that I feel like I'm drowning from all those details, sometimes they are self-inflicted details, but spending maybe too much time in the literature. I just have to bring myself back to this moment and try to find something helpful in that moment, and then regain perspective. But faith is a huge piece of it.
Well, and it's interesting that both of you said faith, because faith is not really about certainty. It's not really about reducing uncertainty. It's really about peacefulness, a sense of not being alone.
Yes.
So, and it doesn't, I've always said to people, whatever faith you practice doesn't really matter. Whatever religion it is doesn't really matter. But a lot of people will tell me that they rely on faith. And again, it's interesting, because I don't necessarily see that as something that reduces uncertainty, but it does increase a sense of peacefulness.
Yes.
Would you agree with that?
Yes.
Yeah, it reduces anxiety for me as well. I do. I definitely.
Yes.
Mm-hmm.
Okay, good. And have either of you, or both of you, if you would both address this, have there been certain coping strategies that you've tried along the way that you then later abandoned because it wasn't working so well for you?
One thing I would say is keeping how I feel to myself. And what I mean by that is I'm a very happy-go-lucky person. When everyone sees me, I'm always like smiling and things of that nature. And the only person who really sees me, like not that way is probably my husband. Or sees me when I'm, the times where I feel bad and things of that nature. And so sometimes I feel like it's unfair to him, but I do think that it doesn't help me when I am trying to communicate with my friends and family and want to get their support. When they always see me happy-go-lucky, they don't feel like they need to give me any support, and they don't see the need. And especially since I've had such a long cancer journey. So I'm 38 now, but I've had, I was diagnosed when I was 25, so that was 12 years ago. And they're like, "Oh, you're strong, you got this." And so they're used to me being strong, you got this. But MBC is just very different. And so I would have to say that, I had kind of change my perspective and really let them know how I felt when I felt good and bad.
That sounds to me like it was risky for you, or it felt like you were making yourself vulnerable, right?
Yeah.
When you opened up and got a little bit more honest with people.
Right, exactly.
Yeah, that's difficult to do when you're used to kind of presenting yourself in a certain way, right?
Mhm.
Yeah.
Definitely.
Kathy, how about you? Are there strategies that you've tried and then abandoned because they weren't
I did
helping
the
you?
internalizing thing as well to start with. And there were people I wouldn't even call unless I could get myself into the right frame of mind. So I would appear, more upbeat and positive about it. I was afraid to let people see the way I was really feeling. And so, yeah, I mean, I think that over time has gotten easier. I don't have as long a history as Joy. I'm just about 3.5 years out from my diagnosis. But I do find that I'm a little bit better at that. I'm less apologetic if somebody calls me and, hey, I'm having a bad day. This really does happen. I really do have bad days. And so I think it was a learning curve for me, because I also felt like I didn't want to burden anybody else, with the exception of my husband. And so I was very much very careful. I walked very carefully in who I would approach with certain issues that were bothering me.
And I guess related to that, my patients tell me frequently that they get frustrated with educating others about the
Yes.
diagnosis, because there's a lot of misconceptions, obviously, and a lot of just people don't know about it. And I think that, since both of you are kind of speaking to this idea of being more forthcoming, being more open and honest with others, what happens when you encounter people who don't understand this at all and say things that aren't, that are upsetting or make you angry? How do you handle that? Are you willing to educate them, or do you just kind of walk away? What happens, Kathy?
It depends on the person, I think. I kind of measure their receptivity in the beginning of the conversation, because by the time they ask you how you're feeling, tell you how great you look, oh, you must be done, and all this stuff. Then I enter into that, well, no, actually, if I want to shut down the conversation, some people you can say, no, I'll be in treatment forever. And that's kind of like they just kind of fade off into the woodwork, wishing they had never asked the question.
Right.
But I'm also very willing to educate. But I do find one of the most frustrating things is when you re-educate the same people over and over again. I can't believe it's only been a few weeks since I've seen you last, and you still don't get it. It's very frustrating.
Mm-hmm. Joy?
I would agree with Kathy. I mean, it just depends on the situation. If someone's like, you're going to beat this, you got this, I just kind of let it go. They're just there to kind of cheer me up, make sure that, and be my cheerleader. And it's not like they don't mean bad or anything like that. But I do think, especially with my friends and family who have been with me on this journey, I have to now make it a point to differentiate. I was early stage breast cancer for 10 years. MBC is different. There is no cure for MBC. And, with early stage, you saw me fight it, got cured, I was a survivor, all those things. But that's what they hear all the time. And so you have to kind of re-educate them, and and I have to re-educate them and let them know how MBC is different, how I'll be fighting this for the rest of my life. But this is what you can do to help me. This is what you can do to support me. But you have to keep with that re-education, because people don't get it, especially if you look fine. You look fine. People, they think you are fine. They think you have beat it. You're not, you must not be going through chemo anymore. Or you must not be going through treatment anymore, because you're back at it. You're back in the good fight of life, like everyone else. So yeah. I have to agree with Kathy. It just depends on it depends on the situation.
Well, and I think that both of you and every person I've ever worked with that has metastatic breast cancer works really hard to have a normal life. That is not you could wind up in a puddle on your bedroom floor, right? And maybe you were there for a little while at first. right?
Right.
But you had to figure out how to pick yourself up and how to move on and how to continue living your life with this new diagnosis, and with this diagnosis that really is very, very demanding of your time and your energy and your attention. And people don't see that, you know, how much work you've had to do to appear normal to the rest of the world, right? Do you ever share that part of it, Joy?
I'm starting to. As part of this my advocacy journey, I have been trying to kind of share, hey, this is NBC, this is me, these are all the different, this is all the different aspects, this is the roller coaster of NBC. Every day is different for me. One day I'm like, on cloud 9, it's this like fantastic. And then, last week, today I look great. Last week I was miserable. I was sick and I had to explain that to people, or, and you just, it's something that you just have to manage.
Yeah.
But
Kathy, have you shared that part of it? That's the struggle to go back to normal life?
I have with some of my very closest friends. I have a couple of friends especially who are much more receptive to that sort of thing and have been really right there from day one. And so they probably know more than anyone else outside of my husband those tough days and what it really looks like. But most people probably not. Yeah, I mean, I think that I agree with Joy. I'm not as far along in this advocacy thing as she is. She's been much more visible, but I have started with LBBC, and I am with their latest Hear My Voice advocacy group, and I'm finding that that's been really good for me to draw me out more. And I think, I mean, right from the beginning, it's the easiest thing in coping is to try to help somebody else.
Yeah.
And that's kind of been the way I've always been. And now it just seems more urgent.
Yeah, I agree with you. And I think that one of the most important conversations that I know I have with my MBC patients is about finding meaning. Finding the meaning in this experience, which is hard to hear at first, and especially early on, you don't want to have meaning. But when you become an advocate and you're helping other people, it changes things, right? It brings meaning to the experience. What other things have you done that have brought meaning, purpose to your experiences? Joy?
I would say, I mean, in addition to kind of doing, the advocacy work with LBVC and other organizations, one thing that brings me meaning is advocacy, not just for the breast cancer community and the metastatic breast cancer community. And, and obviously I'm a Black woman and, and I I'm active in in the minority communities and around disparities, but also my own family and how I can kind of help them navigate, when it comes to their own health. And how do they navigate and be able to self-advocate for themselves and learn to self-advocate? That actually, my husband's like, whenever someone gets sick, they give you a call and you just kind of, no matter what they have, they want to
have a cold, right?
It's like this counseling session, or, hey, this is what you should talk to the doctor about. This is what you should do. Yeah. And then that makes me feel so good to be able to help people in my family as well, who, who may not have reached out prior, but now that they know that there's someone who can really help them intelligently to kind of navigate through this web of, of health and emotion. Yeah. I mean, that gives me, I don't know, that brings me joy, not to, no pun intended.
Play on your word. Yeah. I think that's a really good point, though, is that you have this experience with navigating not only the medical world, but you had to figure out how to navigate an experience that you didn't know anything about. You know, how to educate yourself, where to look, who to ask, all of those things. And I think that that's really valuable information that you now get to share with your loved ones. So again, when I think about meaning and purpose, it helps a lot to bring meaning and purpose like that into the experience, your sense of, being able to help other people. So, Kathy, do you have anything to add to that about meaning and purpose?
Not really. I mean, I find the same thing, that I'll get a lot of those calls, and I get a lot of people who will say, oh, my so-and-so has just been diagnosed, and so can I give him your number? Mm-hmm. And it's more of a try to boost their morale. Sometimes, I mean, obviously I can't give medical advice, but I can share what I've been through and help them to understand things that I had to figure out a while ago. I mean, I agree. It's been an education all the way along.
Yeah, and to have for your family and friends to have you to turn to like that, I mean, it would have been nice if you had somebody like that, and maybe you did have somebody like that. Some people do get to have that. So. Yeah. I'd like to ask Stephanie if there are any questions that we should address at this point.
Yeah, thank you, Dr. Ginsberg and Kathy and Joy, for addressing so many really important topics. We had a pretty important question come through. Somebody was wondering how you might suggest that they deal with their own mortality.
Okay, it's a big question. So, Kathy, do you want to start with that one?
Boy, that is a tough one. I think that my emotions have run the gamut from the beginning to now in dealing with that. In the beginning, I think I was in total denial about a lot of this stuff. Now I find it almost comforting to just admit that, yes, I mean, everyone should be looking at that, and maybe getting some of the little details of life taken care of, and making sure that who's left behind is, I've done my part, made my little contribution on a lot of levels, not just finding the insurance policy, but, but actually contributing to their well-being going forward, and that they might find comfort in having had time with me.
Yeah, taking care of those wills and advance directives and all of those kinds of things is actually, a lot of people avoid that because they think it's going to be really emotionally difficult, and it is. But there is real relief that comes with that, I think, once it's done, and you can just put it away and then move on with your life. So, Joy, how do you respond to the question of managing your mortality?
Well, I guess I look at it a little bit. I mean, especially in the times we live in now, I mean, every day is a gift for me. And, I could get hit. I don't want to say I could get hit by a bus tomorrow, but I could get in a car accident tomorrow and pass away. And so I want to make sure that at least, I know that it's most likely I will pass away from breast cancer, right? If so, God forbid something else doesn't happen to me before. And so I just have to literally cherish every day, put the plans in place for my loved ones as well. And make sure that I am enhancing those relationships that I may have forgotten before, or not necessarily forgotten, but you haven't called someone in 6 months, or you hadn't talked to someone in 5 years, or, those types of things. And you want to make sure that, of your 10,000 godchildren that you may have, that you have, that they know you, and, they know you, they know the type of person you are. And then you're kind of imparting pieces of you into all those people around you. Yeah. And that's kind of how I deal with my mortality, is making sure that I'm leaving pieces of me with other people, so they know me when when I'm no longer here. And they feel the spirit of me when I'm no longer here.
So that's really, we're talking about legacy, you know, when we talk about that, and being very conscious and purposeful about what your legacy will be for once you're gone. And I think that, again, it brings meaning and purpose to the experience when you can have some say about what your legacy will be, when you let people know how you feel about them and you influence their lives in some way that on purpose, that's legacy. So that's a really important thing to talk with your loved ones about, which kind of brings me to the next topic that I wanted to talk about, which is communication, and how you communicate with those around you, with your close family, your close friends, with people who are kind of further out. I always use the metaphor of layers of an onion, that the people in the middle there, that little tiny piece in the middle of the onion, are like your most important 2 or 3 people in your life, and then your very close family and friends, and it kind of goes out from there. And I always see that as layers of intimacy, how much intimacy there is, emotional intimacy with people. And if you know where people fall in the layers of the onion, it helps you to understand how much emotional intimacy there is with them, and how much you should talk to them about things that are important to you. But how do you, for the most important people in your life, the closest family and friends, the middle of the onion and the first layer or 2, do you talk openly about mortality, legacy, your feelings about the experience of this illness? How open are you with those who are closest? Joy?
I'm probably not as open as I should be.
Okay.
At least in regards to around maybe like mortality, and because I guess it's sometimes I feel like it's inherent in my diagnosis that, you know, it is that I'm thinking about mortality, since metastatic breast cancer is ultimately a terminal disease, right? And so, so I don't necessarily talk about it, but what I do talk about my experience and my feelings with my closest friends and family on a regular basis. I just don't really talk about it in more of a terminal situation. I more talk about it as is more of a chronic illness that I'm managing. And not necessarily, I'm thinking, I'm going to die tomorrow. And just kind of spending time with them. So I can't say that I talk about kind of the terminal part of it. I just more talk about it in regards to living with it and the side effects of living with it and things of that nature.
Do you feel like that's a particular or conscious choice that you've made to not address that, or do you think that it's more of a default?
I think it's more of a default. That's not a conscious decision I've made. And just to be fair, like I said, I'm a pretty upbeat, happy-go-lucky, person, glass half full type of person, right? And so when sometimes I'm not thinking about it. I don't think about it on a regular basis for myself. And so I don't necessarily, it's not at the top of mind when I'm talking to them about my experience either.
Okay. How about you, Kathy?
I would have to agree that I've not been as open probably as I could or should be. It just doesn't come up in conversation a lot. I have one very close MBC friend, and she and I talk about it probably more than I do with any of my other, people that I come in contact with. So yeah. Probably not as much as I probably should.
That really speaks to the value of organizations like Living Beyond Breast Cancer that connect you with other people, because it really gives you an outlet to talk about things that you wouldn't otherwise address. Yes. Yeah, you're both agreeing with that. Yeah.
100%. I say that every metastatic outreach or any type of advocacy program or whether I'm involved or not, I pick up these MBC friends or, and and I kind of collect them because I'm not a big support group person. And so I collect MBC friends outside of support groups, and it's kind of like an informal support group, right? For myself. And so Kathy is right. Those are the people that I'm kind of talking about those harder questions with, and, or at least emotionally harder questions with, versus my family. And maybe it also may be because I'm trying to protect my family too, or for my friends. And so that's probably a part of it too, but you have to have your kind of your NBC little, I'll say girl gang or
your
guy
peeps.
gang. But,
Girl gang.
in order to, as a coping mechanism of getting through this.
Yeah, I like girl gang. I like that phrase. That's a good one. I'm going to use that. Yeah, I think that, I think that that's incredibly important, is to have people that you can really freely communicate with. I run a support group for women with metastatic breast cancer, and it's one of the things we talk about all the time is that girl gang, that gang of women who really understand this language, understand the experience, even when you have different circumstances. It's very, very important. But you mentioned something about, kind of protecting your family. And I see that a lot with people who have metastatic breast cancer. And I see it not only for them protecting their family, but I see their family members protecting them. And so I worry a little bit about what happens when you're protecting them and they're protecting you. What it means is everybody's kind of gone to their separate corners. And are not communicating as well as they probably should. It's called protective buffering, where we just kind of insulate ourselves from them from us. And I always encourage people to, at some point, push themselves to have the conversation about what your fears are and what your thoughts are about the future, and open the door for your loved ones to have that conversation with you. Does that feel really daunting to do, Kathy?
Yeah. Yes. It does.
Okay.
Yeah, it does.
And for you, Joy, it does also?
It does, but it's needed. I do think that it's fair and that it is definitely needed. It doesn't have to happen every day, but I do think, having that conversation on on some type of regular basis, just to pulse check just to pulse check, how I'm feeling, especially how my husband's feeling or my family's feeling, I think would be good. And I just, a pulse check would be good for that.
And also our children. I don't know, do you have children, Kathy?
No.
Joy, do you have children?
I do not have kids either.
Okay, and I just want to address this for those who are listening who do have children, because we tend to do that even more with our children, is to protect them from these conversations. And so, again, I think it's an important thing to bring up. And for children, obviously, it depends on if we're talking about small children or older children, adult children. But either way, I think being able to open yourself to a conversation of some sort about what's going on, because even younger children feel the tension. For example, when you are getting anxious before scan, children pick up on that kind of thing and they don't know what's happening. So I always encourage my patients to find a way of talking with their family members, with their children. Even, Joy, you mentioned nieces and nephews and godchildren and all of that, right? Have you had any conversations with some of these children in your life?
I actually have. One of my best friends, she has these 3 little girls. And so she's kind of communicated a lot of kind of what's been going on with me, how, Tomty Joy is sick, this, that, and the other. And they're like, well, they ask me a lot of questions about, how I got cancer or how I feel or, just a lot of different things. And it's interesting because I was very surprised how many different types of questions they were asking me. And they were very probing, and I was very open and honest with them, and kind of described it with them, and and they kind of told me how they felt about it, and I told them, oh, thank you, and I told them how I felt about it. But so it's just it was really good to kind of have that back and forth with them, and then to realize that even and they aren't my children, they're like they're like my godchildren, and they see and feel all the things that, I emit, I should say. And so they're asking the question. So they're thinking about it, even though I didn't initiate that conversation with them.
Yeah, the children, younger children especially have even less of, they don't have the filter to not ask the questions that
Right.
adults have developed, So,
Exactly.
and it really, we can learn something from that, because those are the questions, but those children are expressing concerns and questions that adults also have, but don't express as easily.
Exactly.
Because adults, we have all these filters. So, Kathy, are there young people in your life that you have spoken to about your diagnosis?
No, not really. We live far from family, and I'm quite a bit older than Joy, so my nieces and nephews they have kids of
Adults.
their own.
Yeah. Okay. Okay. Yeah. I mean, I think this topic of communication is so important when we're talking about metastatic breast cancer for so many different reasons. But I think this idea of how we communicate with those who are close to us is a really important thing to explore, because I want you and everybody else to do it thoughtfully, purposefully, consciously, rather than by default. So,
Right.
Stephanie, I want to go back to you for any questions. I can see that there's a couple questions there.
Yeah, there are. Thank you. And I just want to mention too, for anybody who isn't looking at the chat, that there are some great resources being shared by participants about ways to connect with the community. So I just wanted to point that out to anybody who may not have seen it. Reading through the chat and some of the questions, I will just pose something back. It's kind of a summary of some thoughts and questions on managing anxiety and creating a sense of balance for yourself and how to restore yourself with everything that is going on in your lives.
Yeah, managing anxiety is always the big question, because it's often anxiety that, first of all, anxiety can be very paralyzing. It stops us from making plans. It stops us from really participating in our lives. And so anxiety management tools specifically are very important to have kind of I always say a tool belt, have a bunch of things that you can turn to at any time. Joy, what's your number one tool?
My number one tool. I'm not sure. I want to defer to Kathy. Let me think about this.
Okay, Kathy. What's your number one tool?
I think my number one tool for dealing with anxiety is going for a walk, getting outside and really focusing on nature and looking for bluebirds and cardinals and just changing my focus.
Going for a walk, there's a ton of research that really supports going for a walk in nature. It's interesting because it's one of the most soothing things that we can do for ourselves. It really brings us into the present moment when you're noticing the bluebirds and the trees, and it's such a beautiful time of year, and really recognizing all of that, feeling the air on your skin. So that's one of my favorite tools, is just getting outside, going for a walk in nature. It's a great one.
So I can agree. I would definitely agree with that, and just disconnecting when I do. So a lot of times I'll go outside and I'm still listening to like the news or NPR and doing all these other things, but that doesn't really help with my anxiety. So I have to make sure that
not these days.
Yeah.
So when I am outside, if I'm walking and doing those things, that just making sure I'm disconnected at the same time and just literally just listening to the birds, not like, listening to, distracted by other things, and just kind of being able to kind of focus and meditate. And the other thing is I like to do too is like just to take a bath. Just to really kind of relax when I've had like a very, kind of long day, or just a lot of things going on with life in general. And I know that sounds kind of, it's, I don't know, cliche, but it really helps me kind of decompress and really kind of zone out. And that is, so I would definitely say that. And like I said, all my planning, it's,
yeah. Yes, definitely the planning. The things that I always recommend to patients that they let themselves experiment with, and I always say, let yourself experiment with some stuff. Let's see what works for you, what doesn't work for you, because I want you building a tool belt. I want you having multiple things that you can turn to. So I always recommend getting outside. I always recommend breathing exercises. I always recommend trying meditation if you've never tried it. Exercise in any form is helpful for anxiety management. Picking up the phone and calling a friend is important for anxiety management, especially for women. It's really important that we talk through our emotions. That's one of the ways that we manage things and solve problems. So anything that increases your resilience, that's really the goal here. Again, we don't like to adapt. We don't want to have to adapt to things that are difficult, but actually as human beings, we're really good at it. We kind of move towards adaptation, even very organically. We don't even have to do it purposefully sometimes. We just learn how to do that. And COVID is a great example of that, by the way. We've adapted. Think about how you felt in March and how you feel now. We've adapted even though we didn't want to do that. And that really speaks to human resilience. So anything that you can do to improve that resilience is helpful. Stephanie, are there any other questions we should address?
Yeah, there was a question that came in going back to the topic of talking with children, and I wondered if you wouldn't mind taking a moment just to give some thoughts on this as well. The person sharing the question explained that her son is 4 years old, doesn't know anything about diagnosis, but knows that she takes regular medications and sees the doctors regularly. Any ideas on resources for communicating with children, age-appropriate ways to disclose diagnosis?
There are resources out there, and of course, I don't have them in front of me, so I can get them to you. There's a couple of good ones, and then you can share them. I can certainly pass that information on. I just don't have it in front of me. But I really think that what's important to remember is that your children, even as young as 4, feel their feelings. They feel when your mood changes. They feel when you're anxious. They absorb that. So being able to talk with young children or any children about what's happening in your life is important. I believe it's important to use the word cancer, to name it so that they know what you're talking about, and so you can refer back to that word over and over again. But of course, age-appropriate explanations are important. There's also, for those of you who have a cancer support community nearby, they have children's programs specifically that can be helpful. In the Philadelphia area, we have a cancer support community of Greater Philadelphia that has excellent children's programs, but the national organization can help with that as well. There are resources out there.
Great, thank you for answering that. And thank you to everybody for the great discussion in the chat. A special thanks to all of you who've joined us today, Dr. Ginsberg and Joy and Kathy. It was wonderful having you with us. For Joy and Kathy sharing your stories, and Dr. Ginsberg for moderating the discussion and also sharing your own expertise.